Hello, I'm Christopher, Minister of Health and Wellness. Over the next half an hour, I want to take you through a journey to explore the negative impact of lifestyle-related diseases on you and on the population of Jamaica. Lifestyle diseases, otherwise called non-communicable diseases, is the leading cause of death and premature death among Jamaicans. There's a lot that we can do to change that. A lot of it is up to you. So let us go on this journey as we seek to explore together and hopefully to encourage you to take the necessary action to protect yourself and to enjoy long life and quality of life. Bradeney Hill, Portmore, St. Catherine, 6:30 a.m. It's one of the places where the fitness enthusiasts and the health conscious converge daily to exercise. 30-year-old mother of one, Kian Morgan, is among them. Climbing the hill once a challenge, now she's fitter and stronger. But there's an even greater battle she faces, one that threatens her life and one she's determined to fight head-on. Kian has been living with diabetes since she was 18 years old.
Before being diagnosed, I was having frequent urination, always tired. As I wake, I want to sleep. Always hungry. I was losing a lot of weight. This is like right before I found out. I would have wounds that would not heal. I remember having this cut on my knee, and the cut just expanded instead of getting better, even though I was treating it. And I was always itchy, all of those. I would have bad yeast infection. Mom bring me to the doctor and can't find out why. I wasn't sexually active. Couldn't find out why I was having yeast infection. And it wasn't until I was just passing out the water. As I drank it, it came right out. Lost about 10 pounds in 2 weeks. And I said, Mommy, I don't feel well. I was in sixth form at the time. I said, I don't feel good. And she said, come carry it to the doctor.
She recalls experiencing symptoms years before her diagnosis, but ignoring them. At that doctor's visit, she found out her glucose level was extremely high. The normal level is between 4.5 and 6. Hers was at 28. She had to be hospitalized immediately.
I said, Mommy, her sugar is high and she seems to have diabetes. Laugh. I said, Mommy, probably this is an opportunity for us to start eating healthy because, the two of we have a good weight and, I found it funny. I didn't understand it until it hit me when I went home and I had to learn how to inject myself, how to test my glucose and understand the readings, and also what complications come with diabetes over the years if it's not properly managed.
Kurt Dietrich shares a similar story. He'd experienced symptoms for over 20 years, starting in high school. His diabetes diagnosis came in 2008.
I think the earlier you know, the better care you can take of yourself and the less damage on your body from the disease. So I think we need to be more aware of what the symptoms are so people can be diagnosed earlier and start treating themselves earlier as well.
Before the interview, Ken and Kurt were mere strangers. They are among more than 200,000 Jamaicans living with diabetes who require constant monitoring of their glucose level. For some persons, it means pricking their fingers 10 times per day, frequent doctor's visits, and eating right.
You have to watch everything you eat because eating the wrong thing, determines how you feel. It's a constant struggle. If I have a drink, my sugar goes sky high. You just can't enjoy life a certain way, but you can still live your life as long as you watch what you eat, constant exercise and all of that. But it's not easy to control. Some people say just don't eat sugar or this or that and your sugar will be all right, and that's not the case because you eat the simplest thing and your sugar goes sky high. Sometimes I don't even eat and my sugar is high. I don't know how. You go to bed with your sugar normal and you wake up in the morning and your sugar is high and you're wondering what happened. And that is why you need to be constantly checking to make sure that your sugar is in range.
Diabetes is but one non-communicable disease. Other NCDs affecting Jamaicans include hypertension or high blood pressure, obesity or overweight, cancer, chronic respiratory disease, and kidney disease. So Kian and Kurt have been treating with just one NCD. But what about someone with not one, but 3 NCDs? President of the Jamaica Agricultural Society and farmer Lentworth Fulton has been treating 2 genetic conditions for years, diabetes and kidney disease. During the outbreak of the COVID-19, he suffered a stroke, which has limited movement on his left side.
I think my life was over, and I think that it take a year for me to meet a camera, because you don't get sympathy from anybody who you think would sympathize.
It has been a journey lined with courage and determination for Lentworth. He's determined never to give up, but he does admit that his life has changed forever.
I can't go out. I can't frolic again. And my meals have been restricted. Water is a dangerous thing when you have kidney problem, because if you take too much water, then when you go to dialysis, they have to take off that water from your blood, and that's a dangerous process. So my life has changed significantly, but thank God for the family support.
NCDs are chronic diseases usually develop over time. They are not caused by infections but by our lifestyle and require long-term care and treatment. The most recent Jamaica Health and Lifestyle Survey revealed that 1 in 3 Jamaicans has hypertension or high blood pressure, 1 in 2 is overweight or obese, and 1 in 8 has diabetes, or as we refer, sugar. The stats are not improving because many persons don't know their numbers, and with NCDs taking years to develop before symptoms emerge, many persons only become aware when they are at an advanced stage. Having been diagnosed as a teenager, Kian's perspective on life didn't immediately change. She took her medication and changed the way she ate, but the holistic approach, which included incorporating physical activities, took years. But it was a life-changing moment, the birth of her son, which forced her into action.
I had my son when I was 28, and I've had diabetes, found out 10 years prior. So when I thought about, after having him, it hit me like a boulder. After I had my son, I was gaining a lot of weight. Because when I was pregnant, I was on a strict diet. So you see, after when I had him, and I realized I didn't have to be on the strict diet anymore, because I have to ensure that my sugar level is low enough so that he is not affected during pregnancy. And I'm telling you, after I had baby, I started to gain a lot of weight because I started eating on the place. Because I'm feeding someone, so I started eating on the place, and I gained a lot of weight. My ankle started to swell because I was retaining water, and I was like, no, this is a sign of kidney. And I had so much pimples, and my toes were numb, and I just started feeling very unwell, and I said, you know what, they run for your boy. And it hit me. I started feeling disgusted. For lack of a better word, I started feeling disgusted with myself. I'm like, what are you doing to survive? Aside from freak accidents that you cannot prevent, there's something that you can prevent and extend your life. And I need to just eat right. And my son was really my driving force, because I'm like, God, at least make me alive till him can stand up on him 2 foot them. And I had to just change my eating, started working out, started to go to the online gym. And I lost, since I've started out, I've lost over 20 pounds. And I want to lose some more, but I'm currently maintaining for now, and just to ensure that I don't regress.
Some people say that I have more dead than living in my constituency. That's because we have 2 of the largest cemeteries anywhere in the country. The final resting place for so many of our loved ones. The facts are that premature deaths from lifestyle diseases, or NCDs, account for the vast majority of Jamaicans who die and those who die prematurely. And guess what? It is actually increasing. As a result, we have to take a serious look at how we can encourage more Jamaicans to manage their lifestyle, to manage their choices, so that they can enjoy longevity of life and quality of life. Jamaica Health and Lifestyle Survey 2017 lists, among other conditions, diabetes, hypertension, obesity, kidney disease, and cancers as the leading cause of death as a result of lifestyle. In other words, non-communicable diseases. What is worse is that many Jamaicans do not know that they have these conditions because they do not do annual physical checkups until it is too late, until they end up in the accident and emergency room. This is what we're trying to avoid. The survey found that over 500,000 Jamaicans are overweight or obese. Less than half of that number, over 236,000, have been diagnosed with diabetes. A whopping 684,000 persons have hypertension or high blood pressure. 213,000 persons suffer from asthma, and over 16,000 persons have been diagnosed with cancer of one form or another. A major cause for concern is that over 1 million persons have one or more NCDs. Dr. Karen Webster Carr is the national epidemiologist.
When we look at the complications related to NCDs, a high number, and I will look at my figures, for hypertension, of the 684,000 persons who have hypertension, 269,000 have one or more complications that we looked at. So these are persons living with hypertension alone, and the complications would include like chronic kidney disease, amputations, peripheral vascular disease.
Worldwide, NCDs account for 7 out of every 10 deaths. That's about 41 million persons dying annually. The World Health Organization estimates approximately 17 million persons die from those chronic diseases before the age of 70. In Jamaica, in 2020, the year of the onset of the COVID-19 pandemic, 77 out of every 100 deaths were related to NCDs or lifestyle-related diseases. That's 77% of over 16,900 persons dying that year. When compared to 2010, where 12,696 deaths were recorded due to NCDs, the statistics reveal that one more person died from NCD each day over the past decade, and the leading cause of death has changed.
Diabetes in the last few years have become the #1 killer, followed by cerebrovascular disease, that is stroke. And then you go into hypertensive diseases. So these, if you say the top killer would be diabetes, although the prevalence of diabetes is lower than that of hypertension. In the 1980s, diabetes was #5. Now it's #1. So we are having persons with more diabetes, and many of them don't know that they have diabetes.
The experts attribute this change to the lack of physical activity and unhealthy diets. The result? An increase in obesity. In 2017, approximately 1 in 4 children were overweight, while 1 in 10 were obese. As for adults, females outweighed males. 26.4 to 20% were overweight, while 9.5% were deemed obese compared to the males at 9%.
The vast majority of persons don't meet the daily requirement for fruits and vegetables at all. Also, salt. We on average, we eat twice as much salt than the recommended. And then sodium, there's a balance between what we take in, those salty foods, and the fruits and vegetables, where we would get potassium from. And so that balance isn't there.
The data revealed that more females are suffering from NCDs than males, but these females were seeking treatment while more males were dying. Andrea Christie is the Director of Nursing Services at the Sir John Golding Rehabilitation Center, which specializes in treating patients with spinal cord injury. She explains that the center has to expand its offerings to the patients because many of them turn up seeking care with underlying NCDs. Interestingly, it's been noticed that it's the males who delay getting treatment, which worsens their condition. The message, therefore, to males: know your numbers.
In terms of not taking it seriously, that is more with the men. You get them when it is far gone. Sometimes the men will come in for care when they would have a need for amputation, for example, because therefore the diabetes would have far gone, right? Or the arterial blood problem would have far gone and they would need amputation. That's most times the men. I don't know why it is that men find it hard to seek medical help or medical attention, but I can only encourage men that you are not Superman fictionally, and even if you are, there is a kryptonite there for you, and you need to take your health seriously and take care of yourself, change your lifestyle, ensure that you are practicing healthy lifestyle.
A myth that also needs to be dispelled is that NCDs are associated with the older population. The data is showing that the 25 to 54 age group accounts for the majority of persons with NCDs, over 400,000. Globally, people are expected to live on average of 75 years. If an individual therefore dies at age 40, that would mean that 35 years of potential life was lost. A calculation of the years of potential life lost for the year 2020 showed that more than 250,000 years, or 296,578 years of potential life, was lost. This is a 19% increase from the 232,000 in the year 2010, and an indication of an increase in Jamaica's disease burden, as well as an increase in the number of Jamaicans who are dying in the prime of their lives. They are dying young. It is estimated that the economic impact of NCDs in Jamaica, including mental health conditions, will lead to a lost output of some US $17.2 billion over the next 15 years. Not only does this impact development, but it is quite clear that NCDs are now problematic for the growth of our economy.
There are a number of things we can look at. What our population structure look like, what's the demographic of Jamaicans. And so what we have seen over time is that persons were living longer and longer and longer. But now with the NCDs increasing, you have the young people dying. And so at some point, if you include probably migration, our population is going to regress. First of all, we have less births. So 20 years ago, the births, we probably had 50,000, near 50,000 births. Now we are at 30,000 births. So we're dying more, our death rate is increasing, our birth rate is decreasing, and we do have migration. So the population might start to decrease again, as well as our life expectancy are showing signs of decrease. So at birth, we're less likely to live as long as our parents and grandparents. That is a big, big implication. And then the loss of productivity, loss of, for the whole country, that have implication on the economy. Because if persons are, even if they don't die young, they're living with complications of NCDs. In addition, the treatment of NCDs is a long-term, everyday thing.
On the matter of treatment, attention has to be turned to the National Health Fund. The National Health Fund was founded in 2003 to provide support to the country's health system through financing and the provision of pharmaceuticals. There's the NHF card program that provides a subsidy to 22 chronic conditions, essentially reducing the cost of medication. There's also the Drug Serve Pharmacies that offers medication free of cost to people who use public institutions. We are talking here about hospitals and public health centers. In years gone by, the NHF's annual budget for medications stood at $4 billion. Today, that budget is about $13 billion. 10 years ago, the NHF was processing under 1 million prescriptions. 10 years later, that amount has increased by more than 200% to over 3 million prescriptions annually. Everton Anderson is the Chief Executive Officer at the National Health Fund.
Last year, for example, we spent about 4.5 billion in purchasing drugs for NCDs, and that is projected to reach over 5 billion this fiscal year. It is a challenge because as costs grow, you wonder how you're going to find the money to keep managing your patients. So it is a challenge.
The demand continues to rise for medication to treat with what's considered two major conditions to affect the NHF cost: diabetes or sugar and hypertension or high blood pressure. My ministry recognizes this challenge. The cost of treatment continues to increase and long-term treatment can be quite costly depending on the ailment. We have to look at how we contain this cost and work to make people healthier to reduce the overall cost on the healthcare system and on their personal lives.
The subsidies for the diabetes program for the NHF card was nearly 2 billion last year. So that with hypertension would account for nearly 50% of the spend on the NHF card in terms of subsidies. And we see a similar trend in the public health system where we offer the service through the drug serve facilities.
You know, the World Health Organization says up to 30% of the population experience premature mortality or early death because of poor nutrition and a lack of physical activity. In Jamaica, that is our experience, and that's why we promote physical activity programs like Jamaica Moves in schools and in the communities. And we want to encourage all of Jamaica to find something to do, whatever that is. Walk around the park, walk around the house, run, ride, swim, and if you can afford a gym, go to the gym. In this segment, we're going to look at physical activity and proper nutrition and why it is important to prevent premature death from non-communicable diseases. Remember Kian, the 30-year-old mother of one who has diabetes? She knows all too well the importance of being physically active to manage her chronic disease. Being physically active means exercising at least 3 to 5 days per week.
My motto is 6 hours and half a dozen of the other. It's either you go and work every day and kill off yourself, and then take the money to go to doctor, or you spend the time work out and then have that money for the other things. So invest in yourself. Don't just work, and don't spend time in eating right and not. Because sitting around the desk, but you work for 16 hours a day, that's still not healthy. So you need to touch your heel sometime, or if you can't do that, just go to Palisados or just run your house in a scheme. It is so important to exercise and keep up that wellness so that you can be around for as long as God can give you.
It is important to note here that being physically active means just that, being active, doing what you enjoy, which could mean hikes, swimming, running, walking. You do not need to join a gym. You could be walking in the park, around the house. What is most critical is that you get your blood flow beyond the average and you get physically active. The Ministry of Health and Wellness considers itself that national focal point for physical activity through our Jamaica Moves campaign. The campaign urges Jamaicans to know their numbers and to take ownership for their health by eating healthy, exercising, and getting regular checkups.
Well, we do have a lot of inactivity in the population. However, with our new Jamaica Moves health promotion campaign, we're seeing where a lot more persons are being engaged and wanting to be more physically active. So the Ministry of Health and Wellness is really embarking on a journey to get the Jamaican population to be active. Health-wise, there are several benefits that you can get from becoming active. Help to reduce NCDs, for example, the cancers, diabetes, hypertension, heart disease, increase memory, increase mental alertness, increase productivity, strengthen your bones and your muscle. There are so many benefits and I can go on and on. So there are a lot of benefits from becoming physically active.
It seems many Jamaicans have become comfortable living their lives from prescription to prescription. The ministry wants to change this. It cannot be emphasized enough that in order to develop as a nation and achieve economic growth and personal happiness, we have to make the move from clinical to lifestyle choices.
Yes, we want the quick fix, and there's no quick fix when it comes down to your health. We need to really start eating healthy, being more physically active. Of course, the recommendation for adults is at least 60 minutes 5 days a week, and for children it's at least 60 minutes and must be a combination of muscle and bone strengthening activity. So one of the things that we say at the Ministry of Health, physical activity is the best prescription that you can give. It costs nothing depending on the activity. That means it's for free and you can do a lot of different activities anywhere, anytime. We just want the population to be moving. We're not sending them to go be the athletes, you know. We just want more movement for health and wellness.
My baby him play a lot. I don't want him to come up on insulin and then I'm going to be paranoid because I know how easy it is for my glucose to fluctuate and I don't want him to go through all of that. I'm steadfast in how I don't make him have snacks. I don't make him have juice unless I'm having something and I'll make him taste it. But I'll anything he's getting, it has to be healthy. He eats ground provision, meat, stuff like that. But I don't give him chips and I don't give him soda. No, because I just want to ensure that he eats properly from now. So if it even should develop down the road, it's not now.
Now that I know the signs of, of diabetes, I can watch them as well for the signs. Like I was telling you about my son, he's 16 years old and he was just diagnosed. So that's another thing that we need to be aware of. Whatever condition that you have, it's a good chance that you can pass that on to your children as well.
The government, through the Health and Wellness Ministry, is not just talking the talk, but we are walking the walk to help Jamaicans live a healthy, NCD-free lifestyle. We understand that it's only through lifestyle changes that the population will become healthier. In collaboration with the Rural Agricultural Development Authority, RADA, we have embarked on a backyard gardening program to address the complaint about the high cost in acquiring healthy foods.
So, the little easy to catch crops like your tomatoes, your sweet pepper, the pumpkins. You have a little spot in the backyard and you throw out your seeds and you catch a little crops and you use these foods to supplement your market list or your food list. So you cut back on your money spent on buying foods. since you're already growing some of these in your own space.
The ministry has also introduced other policies and programs aimed at encouraging healthy eating, like the food-based dietary guidelines for Jamaicans that provides 8 recommendations targeting our citizens 2 years and older. It promotes the consumption of a variety of foods from all the food groups, including fruits and vegetables, peas and beans, reducing the intake of salty and processed foods, fats and oils, and sugar-sweetened beverages. There's also the Nutrition Facts Panel campaign, which educates Jamaicans on what to look for on food labels, such as the serving size per container, the amount of serving per container, and the salt, sodium, and fat content per container. Another campaign is the elimination of trans fats, where the ministry encourages manufacturers to reduce their usage of trans fats in their products. The interim guidelines for beverages is another campaign established in 2019. It aims to reduce the sugar content in beverages.
Yes, because what it is, these interim guidelines were done in alignment with the National School Nutrition Policy, and therefore we had to ensure that the schools were adhering to the interim guidelines. So we would have provided them with a list of manufacturers that are compliant with the guidelines.
The government is confident that Jamaica can reach the stage where we reduce our NCDs by adjusting our diets, but it will definitely require collaboration. Our principal medical officer believes that consistency in health promotion and health education is also important in reducing NCDs. For example, all the risk factors for NCDs have increased over the last 2 decades, all except smoking, which saw a dip in 2008 because of health promotion and education.
From 1999 coming up, we were having these campaigns about smoking. And the last big one is, as I said, 2013. And we've seen that an increase again. But it's something that we have to continue because returns are there. If we recall, chronic respiratory diseases, which is mainly due to smoking, the deaths from that have shown a decrease over the last 20 years, a significant decrease statistically. So it is important for all of us to know our number as an individual and collectively for the population to work towards decreasing NCDs, improving our lifestyle so that we can live healthier and more productive lives.
By now, I am hoping the message is clear to us all. Don't wait until you have symptoms. Know your numbers now and get your annual checkup. Remember, early detection and constant monitoring for lifestyle-related diseases will definitely improve your longevity and quality of life. Now is the time to change, not when you face a crisis. It cannot be overemphasized that the solution to good health and wellness does not lie strictly on a prescription pad, but in how we live our lives, the choices we make daily, and the time we spend to improve our mental health.
Prevention better than cure, right? How about you start from now? If I had been told before I found out I had diabetes that I could have prevented it, I would. But life different for everybody. But don't wait until it hit the fan. Start. Do something. Go out and exercise. Eat properly. Don't be like, oh, I'm slim and trim, so I'm not forgot gym. Do something. Don't wait until it's too late. And I don't want to sound cliche, but it's the truth. It's the truth. Just exercise. Look at that lady over here. So she comes up the hill every day and she's in her age, but practice makes perfect, not even perfection. Practice makes progress. Yeah? So it might be hard, and trust me, I've been going to I go to E-Park every 4 nights a week and 1 day up the hill. So I exercise 5 days a week. Trust me, every night I run, I did. I run out of oxygen, I'm tired, I just don't want to go another lap. When I finish, I feel accomplished. I feel like I'm doing myself well. And I feel like I don't just feel it mentally, and I feel it in my body. And I look, you can see the difference. If I show you where I'm coming from, after I had baby, I was big. Now I'm not where I want to be, and I'm still pushing, and I might slip up. It's okay. Don't beat up yourself. It's okay to slip up sometimes. Not saying that you should take it as an excuse to continue, but just do something for yourself. Treat yourself right, live right, and you'll see how longer you can live for you and other people. Because I'm doing this for my son, not just for me, but for my son. I want his mom to be around for him. And that means I can't be selfish. I have to take care of myself just for him.
I hope you enjoyed watching, and more importantly, that we all will commit ourselves today to make better choices to ensure quality of life and longevity of life. The most important message here today is that it's up to us in terms of our nutrition, in terms of physical activity choices, and that it can influence, not just for us, but for our families, for our community, and indeed for our country. I'm Chris Tufton. Until next time.